Good morning. I'm very honored to be here today to talk about a form of violence that most of us don't talk about. Violence in a health setting, health center setting. And as we know, most of us and all of us at one time or another, we all seek services from a health facility. So how bad would that be if violence is coming from the very place you're supposed to get support and information? I'm going to talk about forced and coerced sterilization of women living with HIV. Rebecca mentioned about it, but why do we, as the community of women living with HIV, say this is the worst kind of violence? Because it means taking advantage of our situation, of our vulnerability, and not respecting our bodies. So I just want to mention that this is not a new issue, the issue of forced and coerced sterilization. In 2005, International Community of Women Living with HIV identified some incidences of forced and coerced sterilization in Southern Africa and in specific Namibia. In 2008, there was a legal case that was instituted in that country. And as we know, sometimes last year, those 3 women that took the government to court were awarded and they were compensated. But unfortunately, in this month, they are supposed to appeal. The government is appealing because one of the key areas that they noticed is that the women were sterilized without their consent, but there was no link to discrimination. But we all know that that was equals to discrimination. In 2010, International Community of Women Living with HIV Eastern Africa also identified cases of forced and coerced sterilization in Kenya, and we documented these experiences, and that's what I'm going to share with you, the outcomes. So about 40 women were sampled, and I must say that most of these women were unemployed, and others were living in informal settlements. The worst part of it is that most of them were sterilized in private hospitals, and they are not just like private, as in a private hospital, but programs where programs have set out to support women in the community. And I must say that 50 of them were forced, and being forced to sterilize is when a woman does not know they were sterilized and come to know about it later. And coerced is when you are pushed to sign the form or accept sterilization due to some support that you need to get or some intimidation. So, and that is how involuntary sterilization happened. Yes, TL, as we call it, tubal ligation, was done during emergency cesarean section. So a woman goes in to give birth during surgery. When they come out, they are told you've been sterilized. The worst part of it is that a woman signs the consent. The consent is obtained when the woman is in labor. And this happened to me. And I thought I was the most empowered woman supporting other women in the community. And that's the time my doctor was very busy telling me, you need to be sterilized. You can't give birth to another child. I had only one, so that was the second one. And unfortunately, by the time I left the theater, my womb was gone. So that is the form of violence that we are talking about for women living with HIV. And the other thing is that some of the women were receiving some support from these programs. And so it was suggested and agreed that if you need to get support from us, if we have to give you food, if we have to pay your hospital bill when you're going to give birth, and we have to give you formula milk for your child, you have to sign here that you will be sterilized. Really, what would a woman choose? They would choose to get the formula milk for their child in exchange for their motherhood. And unfortunately, some of the health workers felt that these women had already had so many children. And so if a woman is HIV positive, and probably we all know that, we all maybe think about that. If a woman is HIV positive, maybe they should not have many children. But I'm just looking at one area, and it was mentioned here. Most of the women were sterilized because they were either HIV positive and also disabled. So, and one of the health workers would ask one of the women, she told us, the health worker was asking her, what problem that you have, are we going to solve? You are HIV positive, you are disabled, and you are pregnant. And so they thought the best thing is to sterilize this woman so that they don't give more birth to more children. But of course, there is a lot of impact on forced and coerced sterilization, and one of these, and it was mentioned here, is intimate partners violence, and most of the women were deserted by their spouses. Why? Because we know even in an African setting, if you are a woman and you cannot give birth, you are equals to zero. You don't deserve to be in a household, leave alone inherit the property if the husband dies. So most of the women were chased away, especially after the death of their partners. But most of them have also reported like a lot of psychological torture and violence, especially from the community, stigma because of the fact that you are not able to give birth. And so the issue of abdominal pain, we don't know whether it's because of the sterilization, but maybe it's because of their HIV status. But if these procedures were done and were not done correctly, then that is also another added form of violence to the women. So this is what the study recommended, that there should be a survey to better understand the extent of this vice. Why? Because we just sampled a few women in Kenya, but we needed to know are there so many other women in the country who are being sterilized because of their HIV status. But also there is need to strengthen the issues of informed consent and sort of make it clear in the guidelines when women go for these services. But we also need to give a lot of information to women, because as we'll see, most of the women did not realize that these are their rights that are being violated. This is a form of violence from a health center setting. And so because most of them think the health worker is the most important person and they know it all. So if they tell me this is what I need to do, that is what they sign the form and continue doing. So as I said, these are some of the challenges, making sure that women recognize that this is a form of violence and violation of their rights. The other thing is that it is also hard to find women willing to endure the difficult process of the litigation, because their rights were violated. They need to seek justice. But who is going to stand in the dock and keep talking about the same story again and again? A story that has caused a lot of pain. It is difficult for the women. And they are already HIV positive. That is stigmatizing already. And then the other thing is that there is need to strengthen the capacities of the networks. For example, the international community of women living with HIV, we don't have like the legal, we cannot take the cases to court. But we need like that support to be able to bring these cases together and be able to support our women both legally and also to bring justice to them and support them psychologically. So this is what we are trying to do as the community of women living with HIV, is we want to do more research, as I said, to understand, because these cases were in Papua New Guinea, Asia Pacific, all over, I think, and other parts of Southern Africa. But also we want to build a movement to end forced and coerced sterilization. So thank you so much.